My name is Pamela. I'm from the United States, and I came because I had a Tarlov cyst in my lower back. I came to the AIMIS Institute, who offered the top-of-the-line surgeon for the problem that I had in Cyprus. And the location might seem kind of unusual, but given the time frame for what I would have had to wait for in the United States, it was the best option for me. I discovered I had the Tarlov cyst in my sacrum after going to a back doctor in the States who did an MRI on my spine, and we found that I had a bit of a disc herniation. And so I went to a physical therapist on and off for a while and couldn't get any results with that. And my doctor had mentioned that I had some cysts along my spine. So I did a little research and found Dr. Feigenbaum actually does surgery on the Tarlov cyst, and I sent him a copy of my MRI, and he thought he could help me. So that's where we started. It was about 10 years ago that I had some tailbone pain or some coccyx pain that I never could figure out. It kind of came and went. And then I had a period of about 3 years where I didn't have any pain at all. And then all of a sudden I started having some low back pain that radiated into my hip and down the front of my leg and the back of my leg. And the symptoms kept growing and were persisting to the point where I actually had to lay down at about 1 or 2 in the afternoon, sometimes for the rest of the day. So it really started interfering with my normal schedule and work and my ability to do anything. And so that's when some of those symptoms that I had lined up with Tarlov issues, and that's when Dr. Feigenbaum looked at my MRI and thought that that was what was causing my problems. In fact, he could tell that the disc issue didn't have anything to do with the pain that I was experiencing, and the Tarlov cyst was the only thing that made sense. I opted to have the Tarlov surgery here in Cyprus because the wait in the States was considerable. Dr. Feigenbaum was going to be 9 weeks just to give me a diagnosis with the MRI versus 5 days through AIMIS. So I sent my MRI to AIMIS, and within 5 days I got a phone call from Dr. Feigenbaum, and so that cut off 3 months. And then he had an opening in the schedule here for me to come and have the surgery done versus waiting months also in the States for it. And when I weighed out the options, it seemed more logical to spend my time of pain recovering from surgery versus waiting for surgery. So and the other thing is, when you wait with Tarlov, you can actually have more damage done due to the cyst putting pressure on the nerves. So the sooner you get the surgery, really the better. When I started looking at the meningeal cysts, that's what my MRI report said that I had. I asked for the help of several friends and doctors that knew people that might know something about these, and I started reading blogs online about people who have had surgery on these types of cysts, and it looked like there was a lot of failure in terms of the way these were being treated in, around the world, but specifically in the United States. I think there were 4 different locations that offered gluing the cysts or treating the cysts in ways where they were aspirated, and then you would wait and see if the cyst would refill with the fluid. And in my opinion, everything that I was reading was a failure until I found Dr. Feigenbaum, who has come up with a method of treating the cysts so that it really does heal the problem. And so that's what got me on the path to coming to Cyprus to see him and have these treated, was that it really seemed to be the only option that really treats the problem. And in the long run, his patients have had great success with this. And so that's what I wanted to do. And I found, since the time that I started researching this, Several of the doctors that were gluing the cysts and things in the United States no longer offer that as an option. So I'm very thankful I'm at this point in time where things have progressed enough that I wasn't at the mercy of someone gluing and then having the cyst open or the procedure failing as a result of not having something that really works. Coming into this surgery in a foreign country was a really, really different and difficult decision. I worried about the facilities. I worried about the sort of the imbalance in this area, kind of in the Mediterranean right now. I found everything that I could to be worried about. And my husband came along with me, and he was going to be, you know, taking care of me, which he's done a great job. But I have to say, AIMIS has done the most amazing job of really making me feel welcome, secure, comfortable. Everything that I worried about, really, I shouldn't have been worried about at all. It's been a great decision to come. Having the surgery scared me a bit. I worried that I would wake up in a lot of pain and that the recovery would be long and tedious and painful, and I worried that I would be on medication and, you know, the things that anybody worries about, especially with a spine surgery, you know. To have my back opened was a scary thing. But I woke up after the surgery and immediately I started feeling better. And I was off of the pain medication in 2 days. I was walking 24 hours after surgery. And it's been just a wonderful, easy, relaxing recovery, and I'm just so thankful that I went this route. Again, everything that I worried about, I shouldn't have been worried about. It's been wonderful and so much easier than I could have ever imagined. While I've been here in Cyprus, I've met a number of patients who have had different spinal procedures, and all of them have had amazing reports of being well cared for, not having anything to fear. There's another Tarlov patient here with me that we've gotten to know each other, and our families have shared stories, and our symptoms and things were similar. And we've all had really great experiences. I would highly recommend coming to Cyprus and using AIMIS to coordinate any kind of back surgery that you might need, specifically Tarlov, because it's so unique and so rare. I would highly recommend AIMIS, definitely.